Um, so with Taya, am I saying that right, Taya?
Taya.
Yeah. What were you guys thinking, or maybe you guys haven't talked about it yet? What type of appliance to expand her more? Have you guys kind of talked
We
about,
had
or
just thought about the BWS from Myobrace, which is the bent wire system, just a single
okay.
wire, um, because that's what we used on Trinley.
Hmm.
But if you think something else would be better for her, we're open to that.
Yeah, no, it'd be interesting to see, because Taya is how old? She's turning 16. Um, how what age do they recommend that up to through MyoBrace? Do you know? Does it
Well,
is
that's a
there
good question. I don't know.
Yeah, I don't know. I'll it's totally fine. It doesn't have to be figured out now. Just because I've seen in some kiddos past the age of 12 where we have a difficult time with certain expanders because by the age of 12 we're almost like fully grown and um um our bone isn't nearly as malleable.
She hasn't grown for like 3 years.
Yeah. And so sometimes I've seen in other cases where they've tried certain expanders or things like that on um more adult, where we're fully grown and we just have a much more difficult time expanding in there. Some, kids aren't quite as fully formed at certain ages, and so it works a little bit more. So that was my only question, just to see kind of what we were gonna be going with. And then we'll have to work around to see how much it affects tongue space and all of that, which is totally fine. Nothing we have to accomplish or figure out right at this moment. It'll just be good for me going forward, so that I can kind of plan around. Sometimes when we have a device that goes up into the palate, it's a little bit different myofunctional wise, because if we have something obstructing the palate for a short period of time, that's going to affect what our goals that we're trying to accomplish with the tongue, which is
During the therapy, yeah.
yeah, we
But
need those.
you may even switch what you do or pause it or whatever.
And most
Some
of the
of
time we
them,
can
well, she
try
has that
to
in there.
work with the device and get the tongue working with the device in there. And then that just kind of stretches out myofunctional therapy a little bit more, which is totally fine, because devices are needed a lot of the times. So we just work around it, just kind of depending what it looks like. So that's another conversation we'll have. When the time comes down the road, when you guys are looking to expand and seeing what that is looking like.
What kind of devices have you, I think we would like to start her expansion like right now. What
Yeah.
kind of devices have you seen work better for that?
Mhm. So with adults, I've only ever seen really great expansion. And like I said, I'm sure there's so much more out there that I don't know about, and other products. But I grew up kind of in the Vivos world. And I've seen that works really well for expansion with adults, because it actually can help stimulate the stem cells that's surrounding our periodontal ligaments. And so we're stimulating stem cells, we're actually getting bone remodeling, where for a lot of times they have always thought that that's not capable in adults. And we've seen it done, through their systems. There's other systems like ALF appliances and things like that accomplish the same thing for adults. I'm just not as familiar with that specific MyoBrace expander and what that looks like, and if we're stimulating stem cells, or if it's more targeted towards kids who aren't fully grown, things like that. So I would just love to learn more, and see if that's what direction we're heading with. But with adults and expansion, I've seen really great results with an appliance like Vivos, something that's going to stimulate the stem cells, slow growth and development. It takes time where
So
it's
we wouldn't
really rapid.
necessarily be able to do that for Taya, or would we? Unless we went to a different provider, or would we be able to do that if because
Um,
you're a Vivos,
mhm.
but you can't really do it without a doctor,
Right. So
but
it
we aren't really a provider yet. So
mhm.
how would that
Yeah,
work?
so that is something if Dr. Brown was wanting to do it, and if you guys were interested in Vivos kind of all together, we could talk more on what that might look like with, my
He's
Vivos
interested in it.
like that.
Not yet.
Um, I
He
know
wants
there's
to focus on the younger. He wants to focus. So what's happened to him up to this point is he's been thrown into everything without time to learn it.
Yeah.
fully up to this point, and so he really wants to focus in on the younger age group and the prevention
Mhm.
first and learn
Yeah.
that really well, and then see if he wants to expand to Vivos as well. But I would think that if it was possible for us to just treat our kids with it and
Mhm.
to kind of explore that with you, that he
Yeah.
would be more open to doing that than,
Mhm.
opening up the floodgates right away.
Yeah, yeah, and that makes total sense. And that's definitely a smart way to go instead of jumping all in before you even know, are you gonna like it? What is it like? So yeah, there might be I was thinking I'll reach out to a couple of people at Vivos. I also know that sometimes they will, if they think you're interested in Vivos and wanting
They're
to
very
start
salesy.
Vivos. Mhm.
Yeah.
Sometimes they will, I know they did this for another doctor. It was years ago, so I don't know if they still do anything like this, but they let that doctor treat their husband to see what it was like and kind of get a feel for it. So that might be something also that could be a possibility if they think that you're kind of interested. But I'll reach out, I'll ask what if there's any different possibilities. And like I said, I know that's not the only device that could be helpful. That's the one I'm most knowledgeable in, and I've seen it work in tons of cases. But I know ALF, can accomplish the same thing. I just know that that one takes a little bit more chair time and a little bit more because the patient can't turn it at home. And so
Uh,
having to go in to have it adjusted by the doctor much more frequently. But the MyoBrace, I don't know nearly as much about that certain expander. I've always kind of thought MyoBrace was more towards children than what I've seen in adults. But I could be completely wrong with that specific device. So definitely something we'll just kind of collaborate care all
Figure out
together.
how to
How it
expand.
goes.
Yeah, if you wouldn't mind looking into if we might be able to try out the Vivos for
Mhm,
Taya and see how he likes doing it and managing that
mhm,
expansion case. I know he's done ALF in the past,
mhm,
only because when we bought the practice, that's what the current doctor was using
mhm.
for
Okay.
expansion while he was doing TMD work.
Mhm, mhm,
Done a lot of it, but
mhm,
he has done it and he felt like it was kind of antiquated a little bit. And so the
mhm,
Vivos would probably give him a similar feel, but
mhm,
would be, like you said, a more patient interactive process.
mhm. Okay, perfect. I'm just making notes so I can remember to. So yeah, I'll reach out and say, and see what might be possible, and yeah, we'll just collaborate and see what might be best. And obviously we'll know more when she gets an expansion. I'll let myofunctional therapy, what road that might take her, that'll be different. So and then looking at everybody else too, when we're looking at like the tongue space issue, that could be a possibility in the future, is looking at expansion to help correct the tongue space issue so that we can get full results. So in your case where we don't have the proper tongue space, or at least right now it doesn't appear like we have good tongue space for that tongue, things like that. That's always something to think about. That obviously everybody could always kind of have a bigger palate to house that tongue, but to get optimal results, sometimes things like that we kind of think about. So yeah, so we'll make a plan, expansion, we'll see what that's going to look like, and I'll kind of form her program around that route, whatever that looks like. Tongue tie, she has really great anterior mobility. I would like to see a stronger suction to fully assess the posterior, like all the way
Mhm.
back, what that's looking like, because oftentimes that's the piece that's missed. Because she can touch her nose with the tip of her tongue, so that's anterior
I
mobility
also wonder
or
how much
compensation.
of that is that she doesn't have as much of this. So her
Yeah,
nose is closer.
so a smaller mid face, yeah. And so also compensations, we can see the floor of that mouth lifting also. And so what does it look like when we can try and get rid of all those compensations? What is it going to look like then? So hers isn't super, looking at it like absolutely not, no tongue tie. There might be a little bit of that posterior motion still back there, and I think we'll have a better idea when we can get into that section a little bit better. But then we also have to take in consideration the tongue space, which we've already talked about. And so how wide can that tongue flatten out so that we can get a good visual of that? Definite, dysfunctional swallow with the tongue, but also some of that like swishing stuff that she does. And so that's kind of a tricky thing to take away if it's something that like she's compensating to help some other issue.
It's a learned behavior because drinking has given her an upset stomach. She had
Exactly.
she had tons of stomach issues before, less
Mhm.
now. And so it's a learned behavior now. And I
Yeah.
wonder if she could get rid of it now without
Yeah.
an
And
upset stomach.
yeah, and it's something, I think we'll definitely take small steps to try and fix, because what we see, well, one, the tongue is thrusting in the wrong direction, so it's thrusting towards and into her teeth instead of up into the roller coaster pattern. And so one, we know anytime we're swallowing like that, is we're gonna have more digestive issues, aerophagia, swallowing air. We absolutely swallow more air when that happens. Is it causing all of them? There's so many different things that could play into that, but we know it does cause some of them. So I definitely think that'll help getting a more functional swallow in there. And then with the cheek, and that may not seem like too big of a deal, but we swallow almost 1,000 times a day. And when we're using these accessory muscles to swallow, we're pulling on our neck muscles, we're pulling forward 1,000 times a day. So where now, well, I guess she is having some TMD issues now. Over time, we start to see where that makes all of the TMD issues worse. We see neck tension, everything worse, because we're pulling these muscles forward,
Yeah.
doing these odd habits 1,000 times a day. So over time, we really start to see that add up into our adulthood. So definitely taking that small step. Swallowing, we don't typically treat until the end of treatment, until we establish kind of nasal breathing, lip seal, tongue positioning, because we really need tongue positioning to accomplish a proper swallow. So that's definitely something kind of on the back end, but I think it'd be helpful to try and fix that in there. So and then nasal breathing, obviously that tongue isn't, sitting in the correct position, getting it up and out of the airway, making sure we're establishing nasal breathing during day and night in there. So
Got it.
so yeah, nothing like super out of the ordinary, just kind of collaborating with Dr. Brown for expansion, what that's going to look like. So any questions, concerns right now, at least?
No, but I am, the more I think about it, really interested in trying out Vivos if the rep would be interested in allowing us to do that.
Mhm.
I think that would be a good introductory
Mhm.
wet his feet
Yeah.
type of a
Yeah.
thing to do,
Yeah.
is
And I
to
think
try
that's
that on
another
our
thing.
cases.
Yeah, it's not for everybody. And that's sometimes what happens is people jump in and they start all these cases and they're like, oh my gosh, this is not for me. So I think they should do that more often. Well, they don't do that because then some people don't love it and they don't want to do it. So they
Yeah.
back. But it's yeah, it makes sense to try and do it that way. So yeah, I'll reach out. We'll see what if there's any options like that. So like I said, that was years ago. I don't know if they're
Try
still
and check
kind of
this one, see if it's
lenient like that. But
done.
yeah, so I don't think anything out of the ordinary besides just kind of working around expansion in there, which is totally fine. We'll work with it, whatever type of appliance we move into. So perfect. Any questions before we move to Kai?
I don't think so.
Okay, perfect. At least for now. I know there's more to talk about, but um okay. Kai is 18.
Uh-huh.
Okay. And I'm sure you probably know these questions almost by heart now. So what would be the biggest concerns, goals with Kai? What else going on?
Oh, well, because he's had the longest to develop wrong, he's got the most issues.
Yeah.
And he is a full-blown TMD. He has the worst allergies of everybody. So like, if you try to look up his nose, you can't see.
Okay.
He literally can't breathe through his nose.
Is it inflammation or is it mucus or both?
Both,
Okay.
always. And because of that, He's basically always sick. Like he can't keep it cleaned out. Sinus infection back to back to back. He just can't stay well. He's sick so much. In fact, he's sick right now. He just got better from something last week. He's sick again. He's been sick for almost 8 weeks now straight.
Okay.
And so that really impedes his quality of life. So allergies is a huge focus for us with him. We just haven't gotten that successfully quite yet, unfortunately. And then compromised immune system stuff. But I think a lot of it comes from all of this just being, I mean, he has a severely deviated septum. One of the doctors that read his CBCT asked if he had ever broken his nose, if he'd ever been punched, because he looked like a boxer, he said.
Okay.
But that's never happened. It's just that he hasn't been able to breathe out of his nose for so long. He has TMD. He snores terribly, sleeps terribly, has night terrors almost every night, sits up, yells in his sleep, snores really loud, breathes out of his mouth really loud. I can tell that his lower jaw is a little bit back compared to his front teeth. So there's a little bit in there. And I can also see that his lowers are worn down already.
Okay.
And he's a clincher. So it's a lot to unpack for him. Has a big, he's big. He's 6'5", and we
Yes.
all have big mouths and big everything. I mean, he has a restricted airway for his size. It's probably bigger than most people's airways just because he's so big and has a big head and big mouth and everything. No problem swallowing pills or anything, just generally can't breathe out of his nose. And our goal was to try to attack allergies and myofunctional therapy together and see how much we could affect the sinuses. And then if we still need surgery, then we'll do it. But I
For
didn't
like
want to
a
go in.
deviated septum type.
Well, she wanted to do a deviated septum repair as well as a turbinate reduction because the turbinates were so huge that you couldn't get anything in and out. So she was basically going to roto-rooter his whole everything, which is pretty traumatic. And so we're trying to attack it with myofunctional therapy and allergy therapy first to see what kind of progress we make. Have you ever seen it possible for a deviated septum to correct on its own with myofunctional therapy?
So not with myofunctional therapy alone, but with Vivos and myofunctional therapy, we see it all the time. And so sometimes if we have a deviated septum, and I say Vivos because that's what I've seen, but I'm sure any expansion and myofunctional therapy, because our palate is connected to our nasal passages, right? And so
Yeah.
our upper jaw is all connected. And so if we have a more U-shaped or V-shaped palate, then our nasal passages are going to be smaller in there. So if our nasal passages are smaller, anatomically, because our upper jaw is more V-shaped and U-shaped, then that septum sometimes deviates because it doesn't have the space it needs to stand up or stand.
Oh, so then you give it the space it needs and it can come back up.
Yeah, and so sometimes if we widen the palate, and therefore, when we widen the palate, it widens the nasal passages, the deviated septum can straighten itself up. And so we see this in a lot of cases where, like, I don't remember what the statistic is, but the statistic is pretty high of having deviated septum surgery and not getting.
It reverts.
Yeah.
Yeah. And the same with the turbinate reduction. If you don't get it, like what's causing them to be that way in the first place? Well, it's your allergies. So we can go like cut them all out, but they're just going to come back again from your allergies. And that's why I've avoided doing it. But at the same time, I have this mom guilt too of like, well, he can't breathe out of his nose. And so how's he supposed to learn how to breathe out of his nose if he can't breathe out of his nose in the first place? Am I going about it the wrong way? But this is good to hear because hopefully if he needs that and if that would help, maybe we could practice with him on Vivos and see if that helps. No, frozen. Oh, good, you're
Oh,
back. We
sorry,
didn't have
sorry.
to start over. Hallelujah. I was like,
Perfect.
no.
But we've seen in a lot of cases where patients have had septum surgery, um, didn't really do anything or
And
helped.
it'll just go
And
back.
then, but then when we see Vivos, it straightens up mostly, if not all the way. Or if it straightens up mostly, but not all the way, then that's a great time for the ENT to go finish straightening it up because now
And
we
then
have.
it will stay that way because they have
Mhm.
enough room for it. Okay.
Yeah,
Okay,
so
good.
we'll
So
see
that
if
helps
we
me feel better that I've done
can
it in the
that.
right way. I've
Mhm.
but the problem is that we just haven't found the right path until now. And so I
Mhm.
feel like we've just been waiting for a long time while he's just sick for a long
Hard.
time,
Yeah,
not
it's
sleeping
hard.
good and not, yeah.
Mhm.
So I'm
And
glad.
we see turbinates reduce also. So we can do a few tests to see what his nasal breathing capacity is right now, which he's sick right now, so probably even worse, but
But
we'll
he's
see.
not, but he's
Yeah.
basically always like this. Like,
Okay. So it's his
I mean,
normal little bit. Okay. Yeah.
yeah.
Okay. Um, Perfect. And with the inflammation in the nose, we see, so the less we breathe through our nose, the more inflammation we have. And so it's kind of like a use it or
Because your
lose it.
body responds to stimulus. That's what I've
Mhm.
been saying all
Yep.
along. So we got to get him breathing through his nose
Mhm.
so that his body's like, oh, we need these pathways. We need to open
Mhm.
them up a little bit.
Yep. And so we'll start using that. The nose will recognize that and the release of nitric oxide. One of the only ways we release nitric oxide is through the paranasal sinuses, and that gets released by breathing through the nose. And so if we're not breathing through the nose, we have less nitric oxide, which is an anti-inflammatory. It helps with and Google nitric oxide, it just helps with all sorts of things. And so we see more nitric oxide, which helps with inflammation. So it's kind of like a roller
We'll
coaster.
just pipe
And
nitrous oxide into his nasal cannula at night.
yeah, there you go. And you can do some tests. We've done it on just out of curiosity. We've done it on some mouth breathers and to test for nitric oxide deficiency. And they always come up deficient of nitric oxide. So it is really interesting. And there are supplements for nitric oxide that can kind of help, but it's not going to replace the real deal. But yeah, so
Interesting. Yeah, that's
yeah,
all good information. Okay. Good
yeah.
plan for Kai. Okay.
So perfect. Let's run through breastfeeding for him.
Yes.
Okay. Premature at all?
No, he was late.
Late. Okay. No complications
Oh,
and
beggar, 2 weeks
no
late.
birth. Oh my gosh.
Vaginal birth, they did not have to suction him or anything. I almost died, but but he came
He's
out
your first.
normally. Very big head.
Any issues breastfeeding him? Pain, latch, any?
I had so much pain
Okay.
and so many blisters and so many cuts and bleeding, and it was awful.
Okay.
Because he was a super sucker 10,000. He just wanted food. He wanted food really bad, like right
Okay.
now. He was a big eater and he still is.
Okay. Okay.
So
Did
I
those
I
get
struggled with it
better?
a lot.
Did
It
that
did
get
get
better?
better, but
Okay.
not as like it took months
Okay.
for it to get better, but then it got better.
Okay. Finger sucking, thumb sucking,
Not really.
pacifier. Anything you notice with nail biting, putting things in his mouth that you're aware of that you've seen?
He bites his nails sometimes, but I've always encouraged him to not have that habit. It's more of a like laziness, don't want to go get the clippers than it is like a habit of biting his nails. Does that make
Okay.
sense?
Yeah. Yep.
A
Absolutely.
boy thing.
Yeah. Um, Speech, you said they're all great speakers, no problems there.
He's a very good talker and always has been. I've noticed since he's been a teenager, and I've noticed more of the TMD issues coming out and the lower jaw, it seems like being a little further back. I've noticed a change in his speech patterns, or like in a little bit of a lisp when he talks since he's been a
Okay.
teenager that he
Okay.
didn't have when he was younger.
Okay. Okay.
And that
What is
looks to me like when he's saying the S, but these are a little bit too far back because
too
more
far back?
like that's what that's coming from.
Okay. What medications does he take for his allergies?
He takes Zyrtec and Flonase.
Flonase. Okay, so Flonase daily.
Yeah, they used to be, well, he's supposed to do Flonase daily. That's been a constant compliance with
Okay.
him.
Mm-hmm.
He'll get, really sick and start to get a sinus infection, and then it'll be very pertinent, and then he'll do it again, and then he'll kind of get off the train again with it. So that's something that we're working on, is continuous compliance with that to keep the inflammation down.
Mm-hmm.
Also, a goal of ours is to get him to, because he's not afraid of nasal rinse. It's just that he's a very busy boy. He likes to be
Mm-hmm.
busy and going, and these maintenance things are just annoying. And so the nasal rinses,
Mm-hmm.
we're not as consistent. I think that they would really help him a lot. And we're not as consistent with that until it's like, oh, I have a sinus infection. I better try to rinse it out. So
Mm-hmm.
I'd like to see that happening daily if we can get him to, or a few times a week,
Mm-hmm.
to help with that.
Yeah, cool. Okay. And we definitely talk about implementing some of that also. So hopefully both aspects, kind of telling them will be helpful.
I think maybe some accountability would be really helpful, to where we keep track of it for him and help him with that.
Mhm.
Him and I both were major quick start. Like, we can start things and we can grow things and we can get them done, but like the little detail follow through things are really difficult for him and I both.
Okay.
They just don't flow naturally from us. So sometimes we need a little support there.
Okay. And sinuses, just always difficulty draining sinuses. They won't drain, just sinus infections. Okay. So we often see that too. Like I said, I don't know the shape of his palate or scans or anything. But we see that very much so in the shape of the palate also. So our upper jaw, and I can show you when we do our education. I have some really cool like actual patient scans and stuff that shows this that we can go through. It's pretty neat. But the floor of the sinuses is the upper jaw, right? And so if our upper jaw is not formed right, the floor of our sinuses, that where they drain, is going to be more closed off.
So they can't drain.
So when you open it up, we see a lot more drainage in there. And so it's really amazing. Sometimes like the pre-CBCT scan, like their sinuses are just packed full of crud. And then their post CBCT scan just completely empty, because now they can drain a
Because
little
now
bit.
they can do their natural
Mhm.
function of draining because they're not pinched off back there.
Yeah,
Cool.
so sometimes we see that too. And the reason I bring up like Vivos and expansion, when we're looking at adults, I've seen in a patient just doing myofunctional therapy, in my cases, the most expansion I've got, which is pretty amazing, from the tongue itself. So we do see expansion from the tongue in adult patients, not nearly like we do in kids. If we can do it kids, the tongue will just expand everything. It's really amazing. But in adults, I've seen 5 millimeters of growth in the palate from the tongue, which is really quite a
That's
lot.
remarkable.
We don't see that in everybody. However, everybody, bone density, whatever it might be, I don't know, is different, but we still might see some changes in growth in there too. So,
Excellent.
okay, so we already covered deviated septum. You guys saw an ENT, wanted to do turbinate reduction. What about tonsils, adenoids?
Removed. The doctor said that they were the biggest he's ever seen. You could see his adenoids from the back of his throat.
Okay. And were there symptoms that went along with the tonsils and the adenoids?
Same strep and sinus infections.
Okay.
It's mostly been illness.
Illness. Okay. Any chronic ear infections, anything with the ears?
Sometimes when he has a sinus infection, his ears will hurt at the same time, and I suspect that he has an ear infection too.
Okay.
But we're treating the sinus infection. So
Mm-hmm.
whenever he gets a sinus infection, he also has ear pain. So
Mm-hmm. Okay, so they kind of go hand in hand in there. Um, okay. Asthma.
more so than the girls, yeah. So his allergies are worse than theirs even. He has the worst allergies of anyone in the family. And like the other day, he unloaded our covered trailer into the dump, and there was a lot of old, like, it was old stuff cleaning out from like the crawl space of the office. There was dust, there was mouse droppings, there was and he like couldn't breathe after. He
Okay.
felt like he couldn't breathe. So it's definitely allergy induced, but
Okay.
he also just feels like he can't breathe enough frequently
Mhm.
from either the inflammation from the allergies or the airway being
Mhm.
restricted or the sinuses being blocked up or all of the above, right?
Mhm.
So which one is it? I think it's all three.
Mhm.
He's not, he usually doesn't have like asthma attacks,
Mhm.
but you can tell that there's somewhat of a component of an allergy induced asthma there.
Mhm. Okay. Food allergies, kind of the same as everybody else. Sensitivities. Okay. Chiropractor work, acupuncture, myofascial release. Okay. Okay, tell me his history with braces and expanders, myo brace, all of that good stuff.
1 second,
Yeah,
please.
go
Sorry.
ahead. No, you're
Take
fine.
care. Sorry, sweetie. Sorry.
No, you're
Um,
fine.
okay, so nothing. We've
Nothing.
done nothing with him.
Okay.
We've talked about everything.
Hmm.
You know, Dr. Baller, when she came, she was like, well, you could, but she was a fairly lazy practitioner. Like she just did the low-hanging fruit and she did it as easy and quick as she could and still get paid, is how I would describe it, unfortunately. And so, which I saw in my kids. And all the other cases that we've had to take over and try to actually do them right and start over on and do the exercises and therapy with them and everything. She basically said, "Oh, you could try it, but he's kind of old." So, and she didn't. But I know there's stuff that we can do for him.
But that's
So we just haven't done anything until
okay.
you.
Okay,
Yay.
perfect. We'll have a good plan. Um, he had his wisdom teeth out, yes?
Yes. Not my choice, by the way.
Okay. Was he having pain problems or just
No, it's
wisdom?
just that they were all up in Breckenridge and he was visiting a friend and they had some extra time and he's like, hi, I'm going to sedate you and take your wisdom teeth out. And they didn't even tell me. And they sedated him and took his wisdom teeth out. And I shouldn't do this because he's going to be listening to this later. And then he went over to a friend's house in Breckenridge and we were still here, and gotten a horrible infection and was miserable for days because he just wasn't taking good care of him because he was like staying up all night and playing video games and eating junk food with his friend. It was awful, the poor kid.
That's what
Um,
happens when your friends are dentists and oral surgeons,
I
right?
know, I know. She's like, let's just do it. We don't need a plan. Just do it. Let's just do it. So
Um,
his wisdom teeth are out. Yeah.
okay. Dry mouth, chapped lips that he complains about ever.
He always has that. Yeah. Because he breathes out of his mouth constantly and he hates it.
Okay. Eating fast, eating slow, anything out of the ordinary?
Crazy fast.
Okay. Oh yeah, you said it.
He inhales his food. It just is like, oh, and it just goes right down into his stomach. And we just like barely are putting salt and pepper on our food and his is gone.
Okay. In no difficulty swallowing pills, right? I think you said it's fine. Choking while drinking water, anything like that. Strong gag reflex.
Mm. Nope, nope,
Um,
nope.
acid reflex.
Yes, we've
Okay.
struggled with that with
A
him. It's
baby
kind of
as a baby in an adulthood or
well, as a baby, they thought he might have it because he puked so much, but he also ate a ton. So who
okay.
knows?
Okay. Headaches, migraines.
He has struggled with migraines before. Hmm.
How often? How many months or
So now that we've adjusted with some allergies, we got out of the moldy house, we're a little lower elevation and done some other things for his health. He's had a much less, but
okay.
he probably, we'll have to ask him, but he probably still has a headache multiple times a week because of all the stuff he has going on. You know, he'll wake
Okay.
up with a headache or have a headache during the day or just tell me that he has a headache multiple
Mhm.
times a week
Mhm.
from my perspective.
Okay. And we'll ask him if we need to, but do you know, is it common that he wakes up with one pretty frequently?
When he is sick, yes.
Okay.
And even other times, yes.
Okay, so morning headache.
Definitely, like he is not a good sleeper. He clenches, he grinds,
Mhm.
he breathes out of his mouth, he has night terrors, like the whole bit.
Mhm. It
He'll
might
wake
be
up, he constantly has this super darkness under
yeah.
crazy dark. Yeah.
It may be worth looking at the sleep test for him too, since it is that bad, especially when we start to see morning headaches. We really correlate all those symptoms of bad sleep, snoring, all that. But then with the morning headaches, that really starts to point towards sleep apnea in there. So it'd just be good to rule out, especially since he's so young. Neck pain, shoulder pain, any complaints of that?
Yeah. Um, if he does have sleep apnea and you say to rule that out, generally through some of this therapy, we can eliminate that, correct?
So depending on the structure, so we have to see how severely, if the structure is super undergrown and the airways like this, then there's only so much myofunctional therapy we can do if we're trying to breathe, like you said, out of a straw. Like if it's itty bitty tiny airway, myofunctional therapy can help keep the tongue out of that. But we're not going to necessarily fix the straw if we're adults, at least. If we're kids, then the tongue can do that, yes. But yes, myofunctional therapy has been shown and proven, and we've seen it. It can reduce sleep apnea up to 50%. So it depends where he falls. If he had sleep apnea, if anybody has sleep apnea, depending where you fall on the spectrum, if it's more in the mild, then we can get rid of it completely. If we're more on the mild moderate, we can get rid of it completely. If we're more high, moderate, severe, we can decrease it by 50%, but it's not going to get rid of it completely. So,
Yeah,
but yes.
that'll be interesting to find out too, once we get his sinuses cleared out, how much of that um contributes to that
Yeah.
sleep apnea going down, because I
Mhm.
feel like that's a huge contributing factor.
Yeah, absolutely. And we see like it would probably for sure come up right now for him for upper airway resistance syndrome because he can't breathe through his upper airway. So but it might be interesting just to see what that starting point is if we have anything going on, that we could kind of see how much it gets better if there is something going on, or just rule it out completely. So
Perfect, thank you.
what is his complaint with TMD? Clicking, popping, pain?
We'll have to ask him.
Okay, we'll bring that up.
I'll have to ask him.
And just poor
I'm pretty
sleep.
sure that his dad heard some clicking and popping and stuff.
Okay. And we already talked about sleep, just poor nightmares, terrors. Any issues with bedwetting?
He did till he was almost 10.
Okay. Does he wake up to use the restroom frequently still at all?
I don't know.
Okay.
We'll ask him.
Snores, dry mouth, mouth breathing. Okay, perfect. I think if he's ready, if he can come jump on, I'm ready for him. We can take a look.
We're ready for him.
He's on the toilet.
Yeah, I know. Go tell him.
Let me get my light on here, see if I can help my.
Tell him to hurry, that we're waiting for him.
Here, quick, so I can show you. And I'm bored too.
Kitchen is there, so.
It's not coming.
And they're gonna have to wait time. Okay. We're doing your equipment now. You get to sit in the hot seat right here, buddy.
Hi,
Hey,
Kai. How are you?
good. How are you?
Good. I'm Chelsea. It's nice to meet you.
Oh,
We're just gonna do some stuff with your mouth, do some tests with tongue, breathing, things like that. Does that sound okay? Oh, sorry, I think it froze up there. Am I back?
yes.
Okay,
Oh,
perfect. Okay, excellent. So we did have a few questions. TMD and TMJ, what are the symptoms that you experience or you notice with your jaw? Clicking, popping, pain, anything like that? What would you describe it as?
chewing into like thick stuff. it fatigues and cramps up and gets pain really easily.
Okay.
Occasional clicking just in chewing. Not and then there haven't been a ton of times where it's been just in pain for no apparent reason, but that has happened. Maybe if I slept on it wrong or something like that. Then that day it'll be kind of tight and unhappy, but
Okay.
not like not massive amounts of jaw issues causing me grief. I think it's more the nasal stuff that is.
Nasal stuff. Okay. And when you're sleeping, the next question was sleeping. Do you sleep on your side, stomach, back? Do you know, or is it kind of all over the place?
All of it, yeah.
All of it. Okay. Do you know, do you wake up sweating a lot in the middle of the night?
There are times where I do, definitely. Lately I've been able to keep my room freezing cold, and so that hasn't been something since the winter, but
One great thing
um
about winter, yes.
so I like I haven't really noticed any correlation with these times where I do wake up sweating a lot, but there are just kind of periods like last summer for a couple months where I definitely woke up sweaty, and there's periods where, and so
Okay, but nothing
it,
correlated
not
to
always, but
always. Okay. And do you wake up to use the bathroom frequently in the middle of the night?
uh,
Yep. Okay. Um, okay, so go ahead, if you don't mind, just sticking your tongue straight out at me.
okay.
Perfect. And I'm gonna have you go to the left and the right and back to the left and the right. And now just keep going for just a few seconds for me.
Just bounce moving a little.
Perfect. Go ahead and relax. That's great. Okay, now go ahead and just try to stick your tongue up towards your nose. Good, and down towards your chin. And then back up towards your nose. And down towards your chin. While you're doing any of that, does it create any more tension problems with your TMD at all?
I'd probably say a little bit more tension, but
Okay.
it's wearing off as we speak.
I'm gonna move you guys into my room because the girls are trying to start cooking and cleaning up the kitchen.
I got it.
Oh, she's frozen. Just let it see if it'll look at its demons. Our internet has not been the greatest today.
Uh-oh.
Hopefully, I don't have to restart because I've been recording it. If we have to restart it, then
Oh, there we go.
Oh,
I
are
think
you back?
that- Yes.
oh,
Okay,
good.
phew.
Phew. We're moving it into my room because the girls are trying to cook and clean up and stuff in the kitchen.
Oh, no worries. Totally fine.
Okay, let me know if I can contribute. Fine, Chelsea.
Okay.
Okay, sounds
Okay.
good. Thank you. Now without creating any tension or pain, so don't open so wide that you're gonna create problems with your jaw, but open as wide as you can, feeling comfortable.
Okay.
Okay. And now go ahead and I want you to put the tip of your tongue behind your front teeth right here.
Okay.
Open as wide as you can while keeping the tip of your tongue up. And now go ahead and close until you can touch your tip of your tongue to your back teeth. There we go. Perfect. And relax there. Any tension problems it's creating in the jaw?
Just like a little bit more tension, like I lift something heavy and it feels like that after, I guess.
Okay. Go ahead and we're gonna try, if you can accomplish it right away, that's totally fine. It's called a suction. So we're gonna try and suction our tongue to the roof of your mouth. So I'll show you what it looks like. It looks like this.
Okay.
And so we're just pushing all of our tongue up into the roof of your mouth. So try and do that for me. And if you can open halfway while you're
Okay.
trying that. Okay. Good. Okay. Is that difficult?
So-so? Not
Little
too
bit.
clear.
Okay. And as you're doing that, is your tongue touching your teeth at all?
Yeah.
Yeah.
I think
Yes.
it's maybe even overflowing, not just touching the sides, but touching the
Completely
tops.
overflowing. Okay. Okay. Now let's do that one more time for me. Go ahead and go into that suction.
Okay.
Mm-hmm. Yeah. Okay. Perfect. That's great. Any tension in your jaw as you're doing that?
Maybe a little, not aggressive.
Nothing crazy. Yeah. Any tension in your neck, in your shoulders?
Maybe a little right, kind of there,
More
but
there. Okay. Okay. Now, as you're sitting there right now, Kai, what is your tongue touching in your mouth? Is it just resting on the floor of your mouth? Is it touching your teeth? Is it touching the palate, the roof of the mouth?
it's touching both floor and roof, I think.
And okay, touching teeth at all?
I'd say in like two spots, relatively small. It does touch the sides a little bit, maybe towards the front every once in a while, but not. Yeah, towards the front some.
Where's it? Okay. And what about the middle of your tongue? Like right
Okay.
there. Is that touching anything? Is it just kind of floating in air? Is it contacting the roof of the mouth?
Seems like most of the time it's not, like it's curved down a little bit.
Okay. So it
So
kind of
that point
curves back.
touching. Hello. And but
Okay.
yeah, I'd say by default it doesn't. It's just the rim that touches all the way around.
Okay. And as you're sitting there now, are your teeth touching together?
No, they weren't. They were just very close to touching.
Okay.
And always and a while back we ran a couple of TMD tests, and for some reason I specifically remember um I remember a few things of it, but that when I'm closing my jaw in a relaxed state, this point right here,
Mhm.
my right hand side, just a few teeth from center is where it touches first. And so if I'm
Okay.
relaxed, that'll
That'll touch
occasionally
first there. Okay.
and it'll definitely tap first if they do.
Okay. All right. Now we're going to do a few swallowing tests here. So probably get a glass of water. If you don't have one, you can go grab one. It's a lot easier than just trying to swallow.
Back.
Yeah.
Are you really done already?
All right.
Okay, perfect. So first of all, I just want you to take just a drink like you normally would. Just go ahead and take a sip of that water. And go ahead and do that one more time. Okay. Now I'm gonna see, it feels kind of funny. Can you take a little sip of water and then put your cheeks back into a smile and then
Okay.
swallow for me?
Okay.
Okay, it's kind of weird. Yeah,
Was that a closed smile?
yeah. So do an open smile if you can. Big cheesy smile. Yep.
Oh,
So
okay. With okay.
with the teeth. Yep. Okay. Did you swallow first or did you
I
swallow
didn't
twice?
swallow first.
Okay. Okay. Do that one more time for me.
Okay. So
So take
after I
a
make the smile, do swallow.
exactly. Yep. So take a little bit of water in your mouth, smile, and then swallow. Okay. Okay. And now I want you to take a couple drinks and I want you to think about, from your perspective, what your tongue is touching in your mouth. So is it touching teeth? Is it touching palate? What all is it doing in there?
As I swallow, or
As you swallow. Yep.
I'd say the tip of it, rolls off the front of my teeth
Okay.
and rolls down the palate,
Okay.
and touches the side of my top teeth all the way down.
Okay.
But yeah, it's starts touching. It pretty much touches most of my palate and most of the inside of my teeth, and just starts and rolls back on those.
Okay. Perfect. Now I know you're kind of sick and congested now. Is that right?
Yeah.
Okay. So I want to do a little test. I want to see and let me know anytime you feel like you need to breathe out of your mouth. Feel free, open your mouth, start breathing how you need to. Okay. I want to see is there like a piece of paper you can fold up? What I like to do, or like a business card, or just something small that you can do this with.
Okay.
Just put in between your lips, just a sticky note you can fold up, just really anything besides like Kleenex. I don't recommend that. It gets stuck to your lips easy.
Here's a thing of sticky notes.
Perfect. So yeah, just take a sticky note, fold it in half. I just like something in between the lips so that it's conscious awareness that we know we have to keep them together, essentially.
Oh, okay.
So
I got you.
hold that sticky note in between your lips. That's exactly right. And then make sure you're trying to breathe through your nose. You're not holding your breath. And I'm starting my timer is what I'm doing. Okay. So we're gonna see if we can get to 2 minutes. But don't feel like you have to. So we'll see how far we get. The moment you feel like you need oxygen, just pull that out, start breathing, and just pay attention to how you're feeling here. We're at a minute here. You doing okay? Yeah, great. And then if you're doing okay, still good, I want you to put one hand on your chest and one hand on your belly. And can you tell me which one feels like it's moving more? Is your belly moving more as you breathe, or is your chest moving more when you breathe? And then we have about 20 seconds left, and then you can answer that as long as you're still doing good. Okay, great. You can go on to stop, pull that sticky note out. We made it 2 minutes. So first, chest moving more or belly moving more?
Belly.
Belly.
Yeah. I guess I probably could have shared this earlier. I didn't think about it. I can usually go to bed breathing through my nose.
Okay.
And it bothers me when I'm trying to go to sleep and I can't breathe through my nose, which happens unfortunately kind of often because I'll be congested. But I definitely prefer going to sleep and breathing through my nose. It just feels, uh, I have a hard time because I'll just be trying to go to bed as usual, breathing through my nose, and I'll be congested or something like that, and find that I can't really, and I'm shoving it through it. Eventually, I just transition to my mouth.
Okay. So you're aware of it, of
Don't
what
like that.
and
Yeah,
you prefer nasal breathing, you want to. Yeah.
I get better sleep.
How was that 2 minute time frame? Was it easy? Did you feel like you weren't getting enough air? Explain that to me.
I had just fine. It was easy.
It was
I
easy.
didn't. Yeah. I mean, have you read the book? My dad got me to read part of. I think it's Breathe. I think it's just named Breathe, where it's just like sipping through your nose. Yeah, I only read part of it, but
Yep.
in that part that I was reading, I got a bit of an instinct to when I need more air, not just want to get more because I know that just a slow sip is enough.
Mhm.
So maybe that's a bias test, but I think if I go to bed sleeping, breathing through my nose exclusively, then I figured 2 minutes is probably fine either way.
Yeah,
So I
yeah,
don't think that.
perfect. Yeah, that's great. Okay. And the reason we do 2 minutes is usually if we can get to the 2 minute mark with nasal breathing exclusively, then we have a good chance of obtaining long-term nasal breathing and turning you into more of a nasal breather. 90% of the time is what we aim for, without intervention of surgery, ENT stuff, turbinate reduction. I know there's a few different conversations, so that's hopeful. That's good. You said your congestion gets worse as you're sleeping.
Ooh, yeah, I'd say that's probably true.
Yeah.
It's weird because it almost seems to get worse before bed. Like,
Mhm.
um, and there's probably just a simple reason for this, and maybe I'm just more aware of congestion when I'm trying to go to bed because I'm trying to breathe through my nose.
Mhm.
Um, because it just feels a lot better.
Mhm.
And but it feels like every time I go through the motions of getting ready for bed and hop in my bed, and I've gone from being able to breathe through my nose to feeling a little bit congested, which is kind of strange. But
Yeah. Okay.
um,
It's common. We hear that a lot. Yeah. Um, can you breathe through one side of your nose easier than the other? Um, Go ahead and try.
this one, my left hand side,
Okay.
and that's usually the case. I think this one's usually more dominant, but it does go back and forth.
Back and forth. Okay. If you do this, like if you kind of put your fingers at the end of your nostrils and pull out, does that make it easier to breathe, or is it about the same?
Maybe a little easier. I feel like I almost get the most benefit from
Up here. Okay. So
like sinus pressure, and
inhale.
then
Yeah.
yeah. And like when I do this, if I push kind of up on this instead of just nostrils, that's where it gets more benefit.
Okay.
But I'd say a little bit from stretching the
A little
nostrils
bit.
out.
But right here, definitely.
Yeah.
Yeah. Okay.
And often I'll end up sleeping with kind of an arm under a pillow like this and the pillow
Mhm.
pressed kind of like that because it's nice to set something right there. I feel like I can
Mhm.
breathe easier on whatever
Yeah.
side.
Yeah. Okay. If you don't mind, can you just turn to the side like this so I can see like a profile in there? Yep, that's perfect. Yeah, I'm gonna just look forward. And go ahead and smile for me.
It's
And it's a
impossible to not do a cheesy smile, right?
cheesy big smile. Okay, now turn back straight towards me. And I'm gonna have you do another big smile. I know. Perfect. Okay. There's nothing weird about sticking your tongue out, smiling, right?
Yeah.
Okay, let's see. Oh, one other question when you're sleeping with headaches. How frequent is it that you wake up with morning headaches?
Ooh, I think it's if I have to drag myself out of bed, then it can
Mhm.
happen. Like one of those mornings where you sleep through your alarm and then maybe you've had set a second one and so you make it up. But you just one of those mornings.
Okay. And
And
how
then I'll probably
often,
have it from it.
yeah, how often do you feel like that occurs?
Um, I try to make it not very.
Mhm.
Depends on if I've got my early morning class running that starts at 6:20. And so of course, having to wake up a couple hours earlier affects that a lot. But
Mhm.
I'd say that if I get the hours of sleep that I need and wake
Mhm.
up, especially if I wake up naturally, I probably won't wake up with a headache.
Mhm.
If I wake up to an alarm and it's a little less sleep than I need, then I'll probably be okay. And then I'll get a headache if I really have to drag myself out of bed, and that only happens maybe once a week. And then if it's like bad, and then maybe once every other week if it's not.
Okay. And is your sleep routine pretty consistent, or is it kind of all over the place on what time you go to bed, things like that?
Depends on the period of like the year, I guess. Last for a while, I was really consistent, and that was helping. I like it when it can be consistent, but I'm really bad at finding consistency
Okay.
in it. I'm definitely not a very habitual person. I'm a little
Okay.
all over the place, and so like the last couple of days I've been sick, so I haven't had to wake up, and I haven't really had something to wake up for because I'm just gonna kind of rest, and so I end up staying up late and then end up going to bed early the next day because I realize it's stupid to stay up late when you're sick. But uh, I think that there are months where I do great and I'm to bed at the same time,
Mhm.
and there are months where I don't, and I notice an improvement on the months where I do.
A little bit more consistency is better. Okay. Do you feel like you most of the time wake up feeling pretty tired, or is there ever moments where you wake up feeling rested and feeling good?
I have a hard time remembering any times where I have woken up feeling rested.
Okay.
Um, my version of waking up feeling rested is probably waking up tired, even if I had slept in, given myself time. Um, wake up feeling tired, but once I eat some food and get out the door and I'm driving, feeling super alert.
Mhm.
That is awesome, and I love that. But it's never before then, really. Like I usually
Okay.
wake up tired.
And if there's a day like where you're not sick and it's like summer break or something, and you don't have to wake up to an alarm, and you didn't stay up super late, when you get to wake up on your own, do you wake up feeling rested at all at that point, or still not necessarily?
I was surprised. So I'd say the sample pool that I'm pulling from for this one is pretty small because I'm just remembering like the last month or two, a couple times, like I think it was days where I didn't have anything to do. Maybe it was weekend days, but 3 or 4 different days where I could wake up. I woke up naturally. Maybe it was that I'd stayed up late before. I think I had stayed up late before. But even waking up naturally later in the day, like 10 o'clock, because I'd stayed up late, I need like 10 hours of sleep. It's pretty awful. If I get less than 10 hours, pretty exhausted during the day, which
Okay.
drives me nuts because feel like I don't have enough hours in a day going to bed at 8 just to wake up at 6.
Mhm.
Mm.
Okay.
So I was probably up till midnight and woke up at 10 naturally.
Mhm.
And felt like I got good sleep, but I still was like, I feel kind of tired right now waking up. I
Mhm.
don't feel just like hop out of bed rested.
Mhm.
And maybe half of that has to do with like maybe if I had set an alarm for like 9:50
Mhm.
and I would have woken up at 10, I would have felt actually rested, but
Mhm.
I just kind of slowly came out of it and was like, should I stay asleep? Should I not? Sort of a thing.
Mhm.
Um,
Yep.
maybe from past times where I wanted to sleep in and couldn't because that happens to me a lot.
Yeah.
And so like maybe not just waking up had something to do with it. Like I bet if I
Yeah.
got the exact amount, like, or maybe 10 minutes less than the exact amount, I would have
Yeah.
naturally and set an alarm. I bet I would.
Felt a little bit better.
Uh,
Yeah, I know exactly what you're talking about. That makes sense. Okay. Let's see what else. There was a couple questions I asked your mom that she didn't know, but I think that is about it all. Do you notice you're snoring at night?
I do not.
No. Okay, so you don't ever wake yourself up snoring at all.
No, in fact, if you ask me, I'd say I didn't snore, but
Okay. I know it's always hard. Um, yeah, some people notice they snore, some people don't. Your mom thinks you snore, so. Let's see. Okay. Oh, one question. It might be too late for you to remember. After you breathe through your nose for that full 2 minutes, did it seem like breathing got easier or harder, or didn't change at all?
I would probably say easier. It also close to the same, but easier.
Maybe it's
Um,
slightly easier. Okay.
um, it also since I'm congested right now, today I've kind of been going back and forth between breathing through my mouth and my nose.
Mhm.
And that started me breathing through my nose again. So I've been breathing through my nose since we
More.
thought about that. Majority. There's probably been a few times like start talking and keep breathing, but
Yeah.
um,
Let's
it it made me breathe through my nose, and so I think it
notice
got
a bit
easier.
more. Mhm.
Yeah.
Let's do, I want to try just a breathing exercise real quick to see if it helps with the congestion at all. So what we're going to do, we're going to just breathe normally, and then we're actually going to hold our breath on an exhale. So you know how we usually hold our breath, we're going to breathe in,
Yeah.
hold our breath, we're going to exhale and hold our breath. Okay. So we're going to hold our breath on an exhale, and then I want you to plug your nose.
Okay.
I want you to shake your head back and forth 10
Okay.
times, kind of slowly. Okay. So you're going to exhale normally. I don't want it like a big pushing everything out, just a normal exhale that you would do. Slightly cover and hold your nose
Okay.
10 times. Okay. Okay, perfect. So breathe normally, just how you normally would. And then on your next exhale, go ahead and block the end of your nose and back and forth 10 times. And then start breathing normally through your nose when you're done. Through your nose, trying to keep lips sealed, normal breathing through your nose. Once you feel like your breathing is back to your normal, I want you to hold your breath on an exhale again and do the same thing. And then just make sure that first breath is through your nose when you stop. And normal breathing, get that breathing back to normal. And if you're feeling doing okay, let's do it one more time. And once that breathing's back to normal, rate your congestion or like stuffiness about the same, worse, better,
Better. Yeah.
better. Okay. And what degree of better would you say? Like slightly better, mild, moderate?
I'd say it was at like a 6 before, it'd be at like a 4.5 now. So like a decent little bit, maybe even a 4. A decent little bit, but not drastic.
Okay.
Um,
Good.
it actually is pretty substantial. Because
Yeah.
before I'm gonna use that. That's kind of nice.
Yeah. So keep using that. That's a tool you can start using right away. It's called unblocking the nose.
Okay.
It seems silly and weird, and I'll explain why and what it does at another time. But it's good news. It's good to see that helps. So I'm just gonna take notes. And we did 3 rounds of that, right?
Yeah, I believe.
Okay. Okay, so that exercise would be good. That's something you can start with right away, super simple. And the best is if you can do 5 rounds of it, if you have time to do 5 rounds. Try doing that before you go to bed tonight and see how your stuffiness and congestion feels going to bed and waking up throughout the night. So, and we'll see how that continues to help. But it's a really cool tool. It can help a lot. Perfect. All I want to see one last time is that suction. If you don't mind trying to get that tongue suctioned up.
Mhm.
Oh, there we go. That's looking good. And tongue is overlapping teeth in almost all areas, does it feel like?
That's right. Kind of over the molars.
In the molar areas, okay, but not the front.
Therefore, it does not.
Okay.
Just back.
And does it feel like it's completely laying over the chewing surface?
Yeah, yeah.
Yeah. Okay. Perfect. All right. That's all I need. Any questions for me right now? Hi.
I can't think of anything.
Okay. Awesome.
Cool.
It was so great getting to meet you. And I'm sure we'll be seeing each other again. I think we're going to be doing some work, trying and help some of these symptoms. Okay.
Awesome. Thank you so much.
All right. Perfect. Thanks, Kai. And then if your mom has a minute to chat, we'll chat real quick if that's okay.
Yeah, I'll go grab her.
Okay. Awesome. Thanks.
Right back. Thank you.
Did you scrub them off? Awesome.
So we gotta get those in the mail. ASAP. Hello.
And he did great.
He's a good one.
Yeah, he's very sweet. So he did great. We did an exercise tonight that was helping open up the nasal passages a little bit already. So he's gonna kind of take that and try and do it a little bit. He said it helped somewhat substantially. So just super simple. Unblocking the nose is what it's called. So he can kind of start to use that to help in the meantime.
Excellent.
So he passed kind of the breathing test. He can breathe through his nose. It's not that he like absolutely can't do it. So we do like a 2-minute breathing test where typically if we can get to that 2-minute mark and we're not like completely like oxygen deprived, we have a pretty good chance of obtaining a lot more nasal breathing without intervention of ENT, things like that. So, so I think that'll be great. I think we can make progress. With him, another thing is still tongue space. And so that tongue just does not fit up into his palate. And so that's a whole nother conversation on, you know, how much you guys are wanting to address if you're wanting to do myofunctional therapy and see how much that's helping. And then maybe looking at structure with expansion and things like that
I
later.
really, they've both suffered so much. And while I've got them with me for not very much longer, I really want to do everything we can. So
Yeah.
I am super duper interested in finding out. I don't know if you have a contact that you can ask at Vivos to see if he would let us try it out on us and see before we go all in. But
And
I think it would be if we all just did it at the same time and kind of you know, had Dr. Brown guide us and the rep guide us and you guide us while we're going through it and doing the myofunctional therapy. I feel like that would make the biggest difference.
yeah, and
What
I
do you
think
think?
I think structurally addressing it would be super great and super beneficial. I think we with just myofunctional therapy, we could probably accomplish and get rid of a lot, so you know, a good majority of the symptoms, but we always have the structure to play with. So the sinuses and the structure, we're not going to be able to, you know, 5 millimeters is not going to be enough to fit the size of that tongue. And so sleep and breathing, if we can't get that tongue all the way up into our palate, it's going to be sitting in our airway. If our tongue doesn't have a place to go, it's going to go in the airway. So anytime we don't have enough tongue space in our palate, our airway is going to be what's going to suffer. And so where we can fix a lot of the breathing problems, we can get them breathing more. Allergies will most definitely, you know, most likely get better with myofunctional therapy. We're still always going to have that limited structure where we don't quite have enough space for things. The nasal passages are more closed off. The sinuses are more closed off. So I think optimal results, I think looking at both of them kind of as a combination would be like ideal, would be like the biggest, you know, bonus in all of it. And so it's just kind of dependent on kind of what direction you guys want to go. But if it was me or my family looking into this, I think addressing both of them, structure and myofunctional therapy, where we see both the biggest benefit, long-term results.
Let's
So
do it.
yeah, so I'll definitely reach out. Tomorrow's kind of my admin day, so that's when I have more time. I can reach out to the contacts that I've had, you know, in touch with Vivos. That's kind of helped me with my journey and everything I've been through with them. So I'll reach out and see, you know, what options there might be and what we can do. And then, you know, I'd be happy to chat with Dr. Brown too. Obviously don't feel pressure to go the Vivos route if he feels like there's something that easier or more beneficial that he knows of, definitely let's chat about it, and we can see what the best option for them is. So that's what's most important, is just what appliance for them is going to work best in the long run. So don't feel like Vivos is the only answer. It's absolutely not. There's some other things that we can look at too.
I agree.
but-
But I do feel like if we were to experiment with Vivos, that with our family, that
Mhm.
that would help him to know a little better if he would want to go that direction with the practice
Mhm.
eventually. So that
Yeah.
might, I think it would accomplish two birds with one stone.
Perfect. Yeah.
You know, Jessica and Loesch, my brother and sister-in-law,
Mhm.
they both have severe airway and breathing and TMD issues. And if we just put all of us in a Vivos and we just all went through all the steps of it, and he were to see maybe that it was easier than what he did over here with this complex TMD and all these other things that we did and the
Mhm.
results that we got. And so it wasn't at like opening as much of a can of worms as it was when he was treating these complex TMDs the way that the older doctor did. It might make him feel more attainable to him and more, he might be able to see the benefits. And I mean, of course, he might see these like, no, but I kind of feel like he'll be able to see, oh, this is a lot more manageable than I thought it would be, you know?
Mhm. Yeah, yeah, absolutely. And we see it go both ways, where it's just not for some doctors, they don't love it, and other people, like, this is what they do. So yeah, I'll definitely reach out. Tomorrow I'll have time to do that. We'll see what we can do. And if Dr. Brown wants to chat more, kind of what we've talked about, have him watch these, obviously, if he wants to, but if he wants to chat to more either about Vivos and kind of what I've seen, so he kind of has an idea if he feels comfortable with y'all going through that. Or if he wants to talk to another dentist that does Vivos to get their perspective from a dentist, I can definitely kind of do that also. So I'll kind of chat with some people from Vivos tomorrow, and then I can let you know. In the meantime, with Mayo, we can get started, whenever. There is a kit, especially since your entire family has TMD. I would like you guys to have the kit before we get started, because there's a tool that we like to use to stabilize the jaw from the tongue-jaw dissociation. And it's gonna be super important for you guys. So sometimes I start without you guys having that, but I don't want to do that with all of your family having TMD. So I can get that in the mail tomorrow. I can get some kits in the mail to you guys, and then we can get started whenever, if that's what you guys are wanting to do.
Yeah, we can look at what your availability next week, and which is we'll probably get it by then, I would imagine.
Yeah, if I send it tomorrow, I usually send it priorities, typically 2 days. Well, I've learned 3 days being down here in Del Norte. It's a little bit slower than when I was in Parker. So
Yep,
3 days.
yep, yep.
So yeah, you should
That too. So it
have
would
it.
seem like when in 1 week we would have the kits in hand, so we could
Mhm.
possibly reconvene on Wednesday of next week.
Mhm. Yeah,
Does
that would
Wednesday work? Wait, what is
Mhm.
today? Today's Wednesday.
Yeah, so that should work fine. And what I'll do, because I know Christmas and New Year's and stuff coming up, we'll start off real slow with just some simple, kind of ease you guys into a few things, give you guys all the same exercises starting out at least. So just
Perfect.
work your way into it, and especially with the holidays, so it's not just completely overwhelming with all that going on.
Yeah, that'd
So
be great. And that'll get us into just making the habit of doing something without it
yeah.
being overwhelming at first.
Yeah,
Perfect.
perfect. Okay, sounds good. So I will reach out to them tomorrow. We'll see what we can come up with. Any other questions for me right now?
No, thank you for all your time. This has
Yeah.
been very awesome. I'm very excited.
Good. Okay. Good. I'm excited to help you guys. And then of course I would still, if you have like 30 minutes, the kids don't have to be there next week sometime where we can just jump on. I would love to just walk through education, just over everything
Perfect.
we cover, so that we make sure we cover absolutely everything. So I'm not skipping any
Perfect.
steps. And then you can see what I always talk about with all my patients. So
Perfect. That's great.
great. Okay, so I'll text you. Does that work? I'll text you tomorrow.
Perfect. Yep. About what
Okay.
your schedule's like next week. That's perfect.
Awesome. Sounds good.
Okay.
So good meeting you.
Thank you.
All of your kids, they're fabulous. So
Thank you. I appreciate you very much. Have a good night.
all right, night.
Bye.